Thank you so much for having me, and thank you all the presenters that have come before me with incredible information. Thank you. I am humbled and honored to come to you from upstate New York, but representing not just upstate New York, but millions of parents in this country. So I share with you my analogy from a parent voice, from a parent lens of our story, which is a combination of TV shows and movies, such as a Lifetime movie, a horror movie, Incredible Hulk, Jerry Springer, The Jeffersons, Medea Family Reunion, Judge Judy, Judge Maybelline, Cops, CSI Miami, Young and the Restless, and even Roots. I've hesitated to share my story because we have remained in crisis on and off over the last few years. And also my child is currently in a residential facility. So I've been hesitant to share our story. I decided to speak up after something horrific, after something inhumane, after something unimaginable happened to a Black male named Daniel Prude, who was experiencing a mental health crisis in Rochester, New York in March of this year. And the community and the nation became aware of his death, or I should say murder, in September of this year. Recognizing that my child has had more than 10 mental hygiene arrests. And what happened to Daniel Prude could easily have happened to my child, your grandson, your neighbor. I could no longer stay silent and had to use my influence, my experience, my credibility, and my seat at the table to elevate the voice to a volume that is noisy, a volume called PEEEEK. So what is PEEEK? PEEEK is people, Black, Indigenous, people of color, parents elevating their voice to educate, empower each other, to eliminate disparities and inequities in services related to the emotional health of our kids. Our story started already full of stigma, distrust, and cultural beliefs. Not wanting to see my great niece in the foster care system, in 2009, I decided to care for her when I was asked. She was only 11 months at that time when I noticed behaviors related to her clinging to me, hearing from preschool that she was having issues regarding being aggressive and not being able to focus. Thinking that this issue came from, as we often think as people of color, her dad's side of the family, or the uncle side of the family, or somebody else's side of the family, but not our side of the family. Thinking it was the environment at the preschool, I removed her from that preschool and put her in a private Christian school, hoping that smaller classes and a focus on faith would be a better option for her. By the time she was 5, struggling at home and at school, which much hesitation related to mental health stigma, our values, our beliefs, distrust in the system, I consulted with her pediatrician and agreed to start ADHD medication so she can focus in school. From the ages 6 to 7, more symptoms, or what I called as issues, surfaced related to her sleeping and struggling, getting in and out of bed, not wanting to go to school. I agreed to add melatonin and clonidine for sleep. Trying to balance my thriving career and being a single parent, learning how to parent a little girl with unique needs was a major emotional struggle. Fast forward to 9, being referred to an outpatient mental health clinic on a 6-8-week waiting list, hoping and praying that we get a Black therapist. The history of racism and levels of oppression and discrimination and distrust continues and are elevated and heightened through and against people of color. Some of the things that I have experienced and heard are unbelievable in mental health settings and so-called trauma-informed models. Over the last few years, I've had things said to me. I need to get my billable unit before the end of the month, so can I see your daughter? You're not like other parents from the city. Your daughter is not as bad as what the team told me. It looks like she was coming over to cause trouble. Do you want to apply for SSI for your child? You appear to be overly aggressive and too involved. Some of our experiences are heart-wrenching, navigating wait lists for community crisis services from 6 weeks to 6 months. More than 10 psychiatric emergency visits at one of the largest education and medical institutions where you're on the first floor of the pediatric emergency that makes the family experience positive and that a red carpet is rolled out to you. You go up just one level, one flight to a modern day Willowbrook where you're waiting for 10 to 24 hours in filth, in setting where no one introduces themselves to you or gives you eye contact or speak to you. Agreeing to have my child to take certain medications in a point of crisis, not understanding the full extent of long-term effects. And here we are 18 months later, and she has gained 60 pounds from the Risperidol. If I was fully educated about the long-term effects and had clear thoughts in decision-making, I would have thought differently. When I think of some of the systematic issues related to policies, practices, and power imbalances, issues, constant CPS reports, emailing over and over and calling for help, parents of color that don't have a voice, that don't know the language and the people that I know. When we walk into clinics that serve 70% of our populations and there's no clinicians that look like us, or clinicians or executive decision-making power that has no representation of parents. The hundreds of families that are in poverty, the hundreds of families that don't have transportation, the hundreds of families that may be struggling with telehealth and technology and that don't know the language. We keep talking about trauma-informed care. What is that to the average Black or brown parent living in poverty? We have normalized this way of life, and you're saying it's trauma? What is trauma? Next slide. PEEEEK is a program that we believe is going to be an international movement led by parents of color who have children receiving mental health services or identified emotional health conditions. We're going to elevate the voices until they're loud and noisy. This is not like any other model you have seen. We have a vision that we will build a network. We will educate parents right where they are in the heart of neighborhoods where so-called organizations that are parent advocacy organizations, we know they're not going in the heart of the neighborhood where Black and brown families are living in oppressive conditions. We are also going to impact change with behavioral health providers. We are coming to you to train you on what works for us, what we need. We're not going to allow you to tell us this is the model for us. We are coming in to train you. We are working with parents to understand the historical perspective and the stigma and perceptions and myths, to get past the build, distrust and trust with systems in each other, to foster relationships that they can talk to a peer that has been through what they have been through, and to impact the behavioral health system for them to understand the historical perspective, for them to understand stigmas, for them to understand the parent lens, to recognize mistrust, iniquities do exist, systematic issues that were in your institutions right now related to your policies, your intake policies, your waiting room, your wait list, your practices, the biases that some of the therapists that don't understand what it's like to be a person of color in the mental health system. Next slide. PEEEEK are core strategies, education and terminology broken down to where parents can understand, not coming in with large words and vocabulary that we don't even know what means. We have funders funding trauma-informed models when parents themselves don't even know what it means. Health, safety, interacting with the police, peer supports, treatment navigation, that is true treatment navigation from the parent's lens, systems change, engaging in change in evaluation, systems level. How do we get rid of these long wait lists? How do we develop models that foster and partner with education institutions that hire and lead clinicians of color and keep them within our clinics? Provider trainings that are not one-time check the box trainings, but trainings with long-term strategies and focus and modules that will help focus groups and simulations where providers can walk in the shoes of parents. More trainings and communication around strength-based, culturally sensitive. For parents, the realities, stigmas, barriers, and settings that they understand and feel safe. And for parents to understand what it means from a generational, what it means from historical, what it means from their current situation, of what it means to be traumatized, what it means to receive services at a regular level or at a crisis level. So we are hopeful that PEEEEK is not just in Rochester, we're in Buffalo, on our way to New York City, and all over the country with a standard of process and care that meets the needs and elevates the needs of parents. Not just being on your advisory board where we get a gift card, but actually coming in as consultants and strategists leading services. This is not just a model to improve outcomes. This is a model that is going to save lives. Thank you.